Well, good afternoon, everyone. We are so excited to bring this webinar to you today. I'm Dr. Tracy Conti. I am the chair of family medicine at the University of Pittsburgh School of Medicine and the University of Pittsburgh Medical Center, so UPMC. So today we are actually going to be talking about connecting with community digital access and digital health. What I want to make sure that everyone is aware of is the Family Medicine Education Consortium has developed this Social Determinants of Health webinar series. Our goal is to improve the health of our nation by strengthening family medicine and primary care to meet its full potential. About the FMEC. We promote family medicine and primary care to medical students. We support residents as they transition in their careers. Our goal is to strengthen our academic family medicine and really create and sustain quality improvement initiatives. We do this by stimulating innovative approaches to primary care and service delivery. So with that, and FMEC being that catalyst, convener, and incubator of family medicine residency programs across the Northeast US. We have a vast footprint as we serve over 60 medical school departments and 195 residency programs. And we are so excited to have you all with us today. Just a little bit about why we feel social determinants of health are important. We know that as we treat patients and as we teach students and residents to treat patients, that it's more than just the medicine, and the social determinants of health has such an impact in how we care for our patients. All of us can utilize other resources from different communities to help us engage in this work a little bit better. And so this is what this series was dedicated to allow us to share resources, to share ideas, and come up with new approaches to be able to help us all in our educational efforts to be able to address these issues. We have to do this. Our ACGME program requirements require that family physicians learn how to do this, that we become advocates for our communities, that we understand the complexity of the health issues that our communities have and how we can combat them. And this is just one way that the FMEC wants to engage with our family medicine residencies and family physicians to help them do that. So this series has many objectives, and one of them is to really look at those things that serve as challenges as we care for our patients and serving them in the communities at a policy and system level, to generate new ideas for us to be able to talk with our patients and refer them to community resources that we may not have thought about, to really work in our communities to look at who are those groups that contribute to the lived experiences in our communities and helping us engage at an academic medical center to connect with those groups and to be able to work with our patient advisory groups. This will also allow us to really integrate those concepts into how we teach our students, our residents, and even as we are on this longitudinal learning objectives as faculty. So I wanted to start off with a little bit of story, because today we're going to be talking about digital access disparities. And this is something that, I became really passionate about in my work with COVID. This is a map of Pittsburgh, just so that you are aware. We have the three rivers. And as we were looking at how we were going to implement COVID strategies, we worked with our partners at CMU and Create Labs to do some heat maps. And if you look, the green areas that are highlighted, those are mainly areas of underserved populations and vulnerable populations, so below the poverty index. What we also did was we looked to see where there were access points for healthcare. And there were access points from the health systems, and that's in these green spots here, happen here. And those at the time were the only folks that were delivering COVID direct care for testing. This was at a time that we were also transitioning from that traditional in-person office visit to a digital platform. We had patients that were complaining that they could not access these points. Pittsburgh, if you don't know, we're a city of bridges and rivers. And so if you look at most of these areas, they were across a river or a ridge, a river or a bridge. So our patients could not access those centers. We also looked to see how could patients reach us virtually. And so on the right-hand side of the map, those areas in pink, those were all areas that were identified as not having broadband access. And so if you look, they correlate with the areas that also were serving underserved communities. So not only did these communities not have testing in their area, they couldn't even access healthcare. And so that's why I'm so excited that we're going to talk about strategies to prevent these issues, to address them, because this is something that happens every day. This is a map of 2020 and where we are with our digital access. And so we know that this is an issue that really is challenging because we're thinking about connectivity, but also that access to quality care. So I'm so excited to have our participants here with us today, and I want to make sure that we give them plenty of opportunity to talk. And so today's speakers, we have Pamela Rosales, who is the Training and Community Engagement Manager at National Digital Inclusion Alliance. We also have Dr. Amber Fedden, who is the Associate Dean for Clinical Affairs and Associate Professor of Family Medicine at Duquesne University College of Osteopathic Medicine, and our colleague, Rebecca Schoen, who's the Assistant Professor of Pharmacy Practice at the Duquesne School of Pharmacy. So thank you to our speakers, and I will turn it over to them.
Awesome. Hello, everybody. My name is Pamela. I will go ahead and share my screen. All right. Okay, so hello, everybody, and welcome to the Digital Inclusion 101 portion of today's session. Again, my name is Pamela Rosales with the National Digital Inclusion Alliance. I'm based out in Kickapoo Land, Chicago, and my pronouns are she, hers. So to start off this section, I want to invite everyone to a Jamboard where I invite you all to add throughout the presentation. Here's a little instruction guide on how to add a sticky note to the Jamboard. The Jamboard is essentially a virtual whiteboard. So you've got a module on the left side of the Jamboard. If you click on the fourth icon, you'll be able to add a sticky note there. And throughout the presentation, I want you all to reflect on your community, and you can list what prevents people in your community from consistently connecting to the internet and using it effectively. So I invite you to add through that throughout the presentation, but some things to think about is, do they have the proper devices? Is affordability an issue? Oh, somebody wrote here, very rural community, lack of high-speed internet providers. Absolutely. In rural communities, that infrastructure for broadband isn't there. I think about digital skills as well. So I see somebody right here, lack of broadband. Yep, digital redlining. Okay, you all know your stuff. So we'll move on, but it's nice to see that people are already kind of aware of the limiting factors or barriers for why people cannot either access the internet or actually use it the way that they want to. All right, so for today's agenda, we're going to go over some basic terms as it relates to digital equity work. We're going to examine the barriers and solutions to the digital divide. And then we'll talk about some community organizations that you can learn from. And then we'll switch over into talking about the policy, because right now it's an unprecedented time for federal funding when it comes to digital equity and digital inclusion programs. So about NDIA, who are we? We are the National Digital Inclusion Alliance, and we advance digital equity by supporting community programs and equipping policymakers to act. We are a nonprofit representing and serving over 700 US organizations in 48 states, working for affordable broadband, access to devices, and digital skills training and support. We are here because we believe that with digital equity, we all win. All right, so let's define some common terms. You might have seen some of these terms used interchangeably, but each of them have their specific definitions. So first, let's define digital equity. That is what we call the goal. It's the condition in which all individuals and community members have the information technology capacity needed for full participation in our society, democracy, and economy. So that participation can look like knowing how to download a mobile health app and navigate within the app, access the charts, schedule appointments, and learn more. It also knows how to being able to connect to the internet, like going on your device and connecting to that Wi-Fi. And it also looks like having that broadband infrastructure in your community. Digital inclusion, on the other hand, is the work. So it's the activities necessary to achieve digital equity. And there's a lot of ways to kind of tackle digital equity through digital inclusion work, but we're going to be covering three main ones that NDIA focuses on. And then lastly, it's the digital divide. This is the issue, right? It's the gap between those who have affordable access to internet skills, digital skills, and tech support to effectively engage online and those who do not. And the digital divide disproportionately affects those who are already impacted by oppressive systems like racism, classism, colonialism, ableism, and much more. That's why you see those affected by the digital divide to be primarily people of color, primarily those who are from tribal communities, Black Americans and Brown Americans, as well as people who are older and have low income. Now, somebody is ahead of us and mentioned in the Jamboard about digital redlining. So we're going to talk about that a little bit because that is a contributing factor to the digital divide. So digital redlining is discrimination by internet service providers, or ISPs for short, in deployment, maintenance, upgrade, or delivery of services. So if we look at this map, in 2017, NDIA, alongside Connect Your Community in Ohio, conducted a mapping analysis of the Federal Communications Commission's broadband availability in Cleveland. And we found that AT&T systemically discriminated against lower income Cleveland neighborhoods in its deployment of home internet and video technologies over the past decade. So this picture is Cleveland. The red are neighborhoods with high poverty rates, and the green is where the fiber enhanced broadband improvements were made. And as you can see, those fiber enhanced broadband improvements was not made in those neighborhoods with high poverty rates. Okay. So we're going to cover three key barriers to digital inclusion, and there's much more, but the first one is broadband. So having that infrastructure, the fiber on the ground, put in place so that everyone has that fast and strong internet access at home doesn't necessarily mean they're going to use it. So broadband equity, it's not the same as availability. Availability is simply asking the question of, can you get connected to the internet? So if you have a device, can you connect to Wi-Fi or home internet? And just because the infrastructure exists in a community, it doesn't necessarily tell us who's adopting, who's actually using that internet at home. And availability isn't taking into consideration the price of that connection, the speed of that connection, or if that connection is reliable. So another term, two terms I want to talk about when it comes to broadband is unserved and underserved. So unserved is an area that has no broadband infrastructure. So folks in that area cannot get connected no matter how much they can afford for an internet subscription, right? There's no wires on the ground that comes to their house to connect to broadband. Underserved, on the other hand, is the significant gaps and variances in internet speed, reliability, and affordability. So a person could get connected to the internet, but there are many factors limiting that experience. So one of it is that the internet is either too slow, and sometimes that's combined with the internet monthly subscription bill is too high. So let's say a community is paying $130 for their monthly internet, but they can't stream Netflix or sending an email takes forever because the internet is too slow. That is a broadband issue, inequity there. And just because you're paying more for broadband, for internet subscription, doesn't mean you're going to get a faster, better service. Another aspect to the underserved definition is that if the technology to get connected to the internet is unreliable because it goes out when there's bad weather or if it's cloudy, things like that would contribute to a community being underserved. Another barrier to digital equity is access to devices. So the digital divide and device ownership disproportionately impacts people with disabilities, as only 62% of adults with a disability own a desktop or laptop compared to the 81% of adults without a disability. And looking more into accessibility, smart homes connected to smart devices like speakers, refrigerators, and thermostats helps people with disabilities have more autonomy and control over their daily actions. So to tackle this barrier, devices have to be affordable so that people can actually have access to them, adequate, because just because something is affordable doesn't mean it's good, right? Doesn't mean it's efficient, and appropriate, because not every device is going to tackle your patient or your community's needs. And we're going to talk about the pros and cons of the 3 major devices in later slides. And then the last key barrier to digital equity that we'll talk about is digital skills, which some folks have mentioned on the Jamboard. So we've all seen COVID, remote work has driven up demand for having these digital skills. And in 2019, a report done by the US Department of Education, they found that 52 million adults do not have the necessary basic digital skills, which is about 16% of the US population in 2019. So what are these basic skills? It is knowing how to turn your device on and off, knowing how to check the battery life and to know, okay, this percent of battery indicates that I actually need to charge it, things like that. So digital skills can financially improve someone's life, but outside of having a job, digital skills allows folks to check the balance on their credit card, deposit a check without having to go to the bank, or knowing how to pay their medical bills online. It's also accessing medical charts online and knowing how to reschedule their appointment or upload important documents. And some more additional barriers that I wanted to highlight is language access. So for folks who are limited English proficient, learning how to build your digital skills can be overwhelming when everything is in a different language. There are a lot of free digital skills building online, and also folks who do it in person, which I will talk about that program later. However, if they aren't culturally competent or can speak to that same demographics language and cultural identity, then it's going to be really difficult. And also fear and lack of trust. So this is a big barrier that practitioners are up against. People have legitimate fears about the internet, such as, is the information safe? Will they get hacked? Identity theft, right? And people might not know the benefits that the internet brings. They have to be bought on to why they want to invest their time and resources into, investing in a monthly internet subscription. And people might have thoughts of, well, I've gone this long without it, so why do I need it now? And so if you have these barriers and there's this legitimate fear of the internet, there's going to be even a harder barrier to come across to convince somebody to want to invest in a device or invest time in learning how to operate that device if they don't trust the internet in general. So those are some of the key barriers that we're seeing in our communities for why people either don't want to or cannot adopt internet or use online the way that they want to. So now we're going to cover the 3 solutions, right? So because you know the barriers, that helps you figure out what the solutions, the steps that you need to take. So affordable broadband, appropriate and affordable devices, and digital skills training. And we'll go over each one in detail. So affordable and low cost broadband. So let's define what broadband is. Broadband is when you have connectivity that is strong, and often that is a wireline that comes into your home. And the Federal Communications Commissions define the minimum standard for broadband speed to be 25 megabits per second for downloading and 3 megabits per second for uploading. When I started out in this field, those numbers meant nothing to me. So I'll describe to you what that really means. That definition was defined in 2015, and best believe it wasn't efficient then. That's too slow of speeds in 2015. And 7 years later, it's not efficient now. So for example, if you have 3 to 4 people in your home, you have 4 to 6 devices connected to the internet, which is including your laptop, tablet, smartphone, gaming consoles, a smart TV, other smart devices. You have 2 individuals that are either working from home or taking online remote classes. You're streaming videos in HD. You're in a Zoom meeting right now, or you're playing video games casually. You're actually going to need 100 megabits per second for downloading, not 25. So I hope that kind of gives a perspective of how 25.3 is not enough for speeds right now. And so broadband adoption, it's daily access to the internet at speeds that are high quality, high speed, and the capacity necessary to accomplish the tasks that folks want and need, whether that is streaming Netflix all day or working, doing a remote job or remote learning. It's also with the digital skills necessary to participate online and on a personal and secure, convenient network on a personal device. So over here at NDIA, we love to create useful toolkits and resources to help you all. Here are some awesome resources that we have, which is a free and low-cost internet tool. And you'll see providers, coverage maps, how to apply, and more information about each provider, which I will put these links in the chat. And then our policy team launched an affordable connectivity program resource page, which tells you everything you need to know about the program. So ACP, it's a broadband affordability program that provides a discount of up to $30 per month for non-tribal households and a $75 per month discount for tribal households. All right, next up, we have affordable and appropriate devices as a solution to the digital divide. So each device has its strengths and weaknesses, and those really just depend on what the community member or the patient needs. So we'll kind of go over each one. Mobile phones, they are great, right? They're small, they're portable, you can bring them anywhere. It has a long battery life, depending on how you use it, but it doesn't replace a laptop. And I think that's where the misunderstanding is when it comes to devices, is that if you have one type of device, you can do everything with it the way you would do with another device, and that's just not true. So if you're going to be working from home or taking classes from home, a smartphone is not enough. And if your main focus is to use apps and light internet browsing, this would work. Another common device is tablets. So this is great for entertainment, right? Binge watching Netflix. It also has a nice long battery life. There is a touchscreen keyboard that provides more accessibility. And unless you have a fancy cellular plan on it, you're most likely unable to make calls. And there are certain apps that don't work for a tablet. And with a laptop, if your community member or your patient is looking to work from home, this is the device that they need. There are softwares that jobs require that can only really be added onto a laptop. They have large storage files, shorter battery life, and affordability wise, out of the 3, this one is the most expensive. And when we think about folks who are using telehealth and apps to learn more about their health or mental health, it's usually done through a phone or a tablet, and those applications might not work well with a laptop. So there's pros and cons to every single one. And it's really just exploring what the person needs to determine what is the best fit device for them. Here is another resource that we have for you. It's our startup manual. You'll learn more about what a digital inclusion program is and have some key answers and questions on how to start a digital inclusion program, as well as examples of programs throughout the country. And the last key solution we'll cover is digital skills training. So if folks have access to reliable internet and the appropriate device, the missing piece here is those digital skills, right? How to actually use those devices and how to connect to the internet. So the Essential Digital Skills Framework, it's a framework that we recommend when breaking down the building blocks of digital skills. So here are some of the basic answers that they have in this framework. So can you turn your device on? Can you use the available controls on your device? Do you know where the power on and off button is? Do you know how to lower the brightness of your screen, increase the volume, put it to mute? Can you interact with your home screen on your device? Do you know how to get back to your home screen? Do you know how to access the App Store? Do you know how to download those apps that you need? Do you know how to search for those apps that you need and update them? Can you update your password at any time when it's prompted to do so? And do you know how to connect to the internet, open a browser, and find and use those websites? All right, so digital navigators. These are individuals who address the whole digital inclusion process, such as home connectivity, devices, and digital skills. And they do that with a community member through repeated interactions. We see this a lot with libraries, but it's also in other anchor institutions. And I will give an example of a hospital doing one. So the digital navigators, they are trained to assess a community member's needs and completely guide them towards resources that are suitable for their skill level, lifestyle, and income. So whether that is somebody who needs to know what low-cost affordable internet plans are in their community, or figure out what type of device would match the needs that they want or the lifestyle that they have, the digital navigator will help them navigate through that. One important thing is that the digital navigators, they aren't the Geek Squad or Apple Genius Bar. You know, they're not Dwight from The Office or that Sheldon from Big Bang Theory. These are people who approach a community member's needs with compassion and empathy and meet them where they're at. So there's not really, you don't really need to learn how to code or deconstruct a laptop to be a digital navigator. So the Digital Navigator program, it was developed as a result of COVID for organizations and entities that needed to continue to serve their community in a socially distant time. So Beth Israel Deaconess Medical Center has a digital inclusion program. They have multiple that utilize both digital navigators and improving patients' digital skills. So on the right, you see here, Erica Camacho and John Torres, who was awarded the Benton Digital Equity Champions Award for their work on digital inclusion projects centered around smartphone-based digital skills for mental health services. So they have a DOORS program, which is the digital outreach for obtaining resources and skills. And it's a series of interactive lessons and designs to help patients develop new skills for accessing and utilizing digital health. So their curriculum includes establishing smartphone skills, learning how to expand knowledge by searching the web, and navigating safely and making smart choices when using smartphones. And they also used a digital navigator program to train their clinical staff on skills like providing a basic understanding of using smartphone tools, basic technology troubleshooting, like how to fix internet connection issues, or what to do if you have a lack of storage space, but you need to upload or download a new app, and then also engagement strategies with patients through the app. So I'm going to share more information about their DOORS program in the chat. And then NDIA's resource for you is our Digital Navigator model page. So in here, you'll have an access to our webinar where we talk about the model, as well as open flexible model and access to skills assessments, follow-up surveys, intake form, and exit surveys, if this is something that you want to look into. All right. So there are plenty of organizations and groups at the community level that patient advisory groups or academic medical community councils can learn from as it relates to digital inequities in your communities. So these are the groups. So extension offices at universities, libraries, housing authorities, education institutions, local government. These are community groups that commonly have digital inclusion programming, whether it's providing affordable devices to students, teaching those digital skills, providing resources and access to low-cost affordable internet subscription plans, as well as doing data gathering and asset mapping. And another community group that you can tap into and learn more from is digital inclusion coalitions. So coalitions, they are a collective of community organizations that share the common concern of digital inclusion. And they're the same anchor institutions that I listed before. So those local governments, libraries, things like that. And they can raise funding for digital inclusion programs as well. So this is a map of the digital inclusion coalitions that has registered itself through NDIA. The green represents statewide coalitions and the red circles are local coalitions. We're working on creating an interactive map, providing you more detail, but this gives you a basic understanding of the coalitions in your area that you may have access to. And so an awesome NDIA resource for you here is our coalition guidebook that we actually recently updated. In it, you have information about how coalitions are formed, their structures, and how coalition adapt over time. All right, so funding. It is an unprecedented time for digital equity funding. The Infrastructure Investment and Jobs Act was passed in November 2021, which appropriates $65 billion to states, local governments, community organizations, and other entities for a range of digital inclusion activities. And you can see that breakdown here on the screen. So almost 2 weeks ago, the National Telecommunications and Information Administration, NTIA for short, released 3 notice of funding opportunities, which opened the application for 3 of the programs. So the first one is Digital Equity Act, which establishes programs that would develop and implement state digital equity plans. Broadband Equity Access and Deployment Program, which is BEAD for short. The program is for states for broadband deployment in unserved and underserved areas, and the Middle Mile Program. We actually just launched a 3-part blog series about the notice of funding opportunities because it can be overwhelming, but we've broken it down for you. The last thing I want to talk about is the policy and advocacy page that we have here that talks about the different federal digital inclusion funding resources. We also have a webinar tomorrow at 3 p.m. Eastern Central Time, where we talk about the funding opportunities of the Digital Equity Act and the BEAD program. The link is in the chat if you are interested. And lastly, we'd love for you to join our thriving community. There's ways that you can join, but you have access to community calls as an affiliate. You have access to our community listserv, which is thriving and filled with other practitioners who have the same goal of digital equity work. And I'll put that link there to join. And we have our Net Inclusion. It's going to be based out in San Antonio. We meet live and we do a lot of different breakout sessions related to digital inclusion work there. So there is my email. I will now pass it over to Rebecca and Amber, and thank you so much.
Thank you. I'm going to share my screen now. Okay. So I'm Dr. Amber Fedden. I'm a family medicine physician with experience in both GME and UME, and part of the proposed medical school at Duquesne University that's set to open in the fall of 2024. And with me, I have Dr. Becky Schoen, who is I'm working closely with at Duquesne University alongside the other members of our team, Pamela Kerner and Michael Perry. And really, it's a pleasure to work as part of an interprofessional team with these folks from the pharmacy program. And so we're going to share a little bit about our educational initiative and teaching about digital health and our plans for that and ways that you might be able to consider incorporating something like this into your educational programs. So Becky, I'll turn it over to you.
Yeah, thank you. So as we start talking about digital health, I'd like for everybody to take a moment and think about what digital health actually means to you. What kind of tools and technologies are you thinking about? We asked this question of our students as well, at least my pharmacy students, and asked them to build a little bit of a word cloud about what terminology they were thinking of. And there may be some differences between what came to mind for you. For many of our students, they did mention some of our more traditional medical tools like continuous glucose monitors, but they also talked about everyday items that a lot of our students and patients have, like Apple Watches and Fitbits, and the use of apps for everything from exercise to meditation. So this can show just how widespread digital health is. And that goes back to the definition, or in some ways, lack of definition for what digital health means. There is no universal definition, but broadly, when we say digital health, what we mean is anytime we have that intersection between healthcare and technology. This can be anything from mobile health apps, health IT, telehealth, personalized medicine, pharmacogenomics types initiatives, wearables, and then just lifestyle and wellness tracking. This doesn't mean that a digital health tool is evidence-based. It can be any type, again, of intersection with healthcare and technology that our patients are using or we're using in the care of patients. So in this really, really broad bucket, again, of things that can be widely accessible to patients or more things that we're using in the health system, there is a segment of that that would be considered digital medicine. So digital medicine is a more narrowed view on digital health, where we're talking about those evidence-based tools where technology serves as a way to measure or intervene on human health. And then further involved in that is digital therapeutics. So digital therapeutics would be practicing digital medicine, but with a therapeutic tool where it's actually using software to prevent, manage, or treat a disease. So again, not any standardized definitions, but these are some broad ways to think about that difference between digital health, digital medicine, and digital therapeutics, and how it may or may not be evidence-based and just how widespread it can be. As we have just talked about, and as I'm sure you know, thinking about your own practice, the use of digital health is growing and growing. And there is a couple major factors for that. One of them is just the volume of money going into digital health. So there is a lot of investment happening in this space. If you look at the infographic on the right, what that's conveying is that there was close to $30 billion in venture capital funding last year of just digital health. And it's a trend that was increasing and then really just further expanded in the past year. So there's a lot of money going into this space and a lot of different companies and initiatives starting in a lot of different areas of healthcare. There's also been some legislation that has in some way involved digital health. And that goes back to most recently things like the 21st Century Cures Act, which is looking at that interoperability, accessibility, and transparency with patients using digital health and information. And we've, of course, seen the effect of the pandemic. So we are not at a peak effect of using telehealth in the way that we were during the early first month or two of the pandemic, but there has still been that continuation due to some changes in the regulations around telehealth and accessibility of it and how it has just become a part of practice. So now it is estimated that about 1 in 5 US adults have had a telehealth appointment in the past month. So I know that for my patients today, I was on the phone, I'm communicating via messaging, we're doing video visits, my patients are using CGMs. We're using these tools every day, and I'm sure that's what you're seeing in your practices as well. And Amber, you may be able to add a little bit here on that too.
Yeah, so my clinical practice as part of academia has largely been underserved residency clinics. I've worked, as part of a free clinic in Central Virginia. And, I'm working with a lot of patients who may not have access to these kinds of tools, similarly to what Pamela is sharing with us earlier. And so, what I'm seeing is a patient, coming in the door who needs a coupon for discount for their medication and has this, fancy iPhone, but has no idea how to download an app, right? And we don't have any coupons in the office anymore. We only can provide these through, the GoodRx app or whatnot. And so, teaching the patient how to download that, how to get access to that, how to show it at the pharmacy, what to do if they run into some kind of trouble with their device. Some of my patients, a lot of my patients had a cell phone, but had very limited understanding of how to use it or how to make use of the tools that they had in that. And I think, you know, and then I had, you know, televisits, right? During COVID, I'm having telehealth visits with patients, and we, you know, our staff at the free clinic would call in advance, practice with the patient, you know, help get them onto their telehealth visit. But, you know, 8 or 9 times out of 10, something would go wrong when we were trying to get them on video, for example. And a lot of these visits ended up being done over the phone, you know, at the last minute, or, you know, due to time constraints or whatever. And so, you know, very real issue with the need to incorporate telehealth, digital health, right? These digital health resources into everyday patient care, and you know, being forced in some ways into using those tools, especially at a time like, you know, when things were locked down with COVID, and yet you know, there being those struggles. And so being aware of these resources that Pamela has shared can be really valuable for your staff, for your residents, for your patients, and that's part of the education that I think is important to provide to physicians and, you know, and other healthcare professionals. So this scenario illustrates the need that we're talking about with our project. So at Duquesne University, the medical school is partnering with the pharmacy school to look at digital health curriculum and say, you know, what can we do to prepare our faculty and our students, right? So we have faculty members who might not be aware of all the tools, might not realize just how much some of their patients are using some of these non-evidence-based tools, or tools that are, you know, floating out there in the digital world. And also might be unaware of how to practically incorporate this into practice. We have our students who want to learn more, want to be able to help their patients utilizing some of these new tools, are seeing patients who prefer to utilize digital tools, maybe they don't know enough about how to incorporate that into everyday care. And then, you know, you have patients who are, you know, trying to make use of wonderful tools that have been developed for this purpose, but maybe don't quite meet the needs of that family, whether it's a social need or a knowledge need, or maybe some other area that's lacking in that. And so, you know, the healthcare provider needs to be the person who can recognize that there's some disconnect in the ability to utilize the tools, or maybe even in the way the tools are designed, so that we can make better tools, right? And so that we can ensure that patients have access to the tools with all the means that are necessary. And so we developed this project with these kinds of gaps in mind. So we're going to do this poll. How much are you teaching about digital health at your school, program, hospital, or clinic? Once we have all the votes in, I think it'll come up.
Give it another second if everyone could answer. I'll share the results in a second.
Okay, so it looks like for most participants, there's little education going on right now for healthcare professionals as it relates to digital health. And we want to share a little bit with you about what's currently being done in our at Duquesne University, and what our proposal is for more to be done. So, you know, sort of starting the discussion here related to medical school and residency programs, we're seeing that there are a lot of challenges to teaching digital health, like the exponential growth in the field. There's, things changing all the time in terms of, what's the latest and greatest tool? Is it effective or not? How can we keep up with this? The same way it's a challenge to keep up with all the updates in evidence-based medicine within broad primary care practices. And we notice that there's, some expense that can go along with some of this. There can be some ambiguity in the role of the clinical effectiveness of these tools. And there's not really a standard or a best practice out there that's readily available for how to teach this. What should we be teaching? And many faculty don't feel prepared to be that educator. And, and then of course, I know very specific to medical school and residency education, how do we make time for that too, right? And so there's just so many areas that, are important to teach about. And when you teach about digital health, you don't just want to teach about the tools that are out there. You need to teach about the big picture. What tools might your patients be using? What tools don't they have access to? What might limit their access? What other resources are available? And so the digital divide needs to be part of that conversation.
Yeah. Absolutely. And so as we think about those challenges, some of the ways that we've been thinking about how to approach that is to focus really on those foundational skills and to not think of it so much about as what the product is, but really how to think about the safety and effectiveness and appropriateness of a product for a patient, since these tools will change over time. Thinking about communication skills and just extending that to digital health, thinking about FDA regulations and evaluating the literature on these tools and just extending that to digital health, so that this is an extension of already existing skills. And hopefully that feels more doable in a time-constrained curriculum and a little more accessible to faculty as well. And to think about how this is just becoming an aspect of healthcare. This is something that is just a way in which many of us are practicing, and increasingly more and more. And so it's no longer a subset of healthcare, but just a way in which we're training our residents and students to deliver care. So at Duquesne in the School of Pharmacy, there are some things that when we looked back and realized what we were already starting to do and to start increasing this content area, we started to talk more about digital health, specifically around the benefits, the challenges, and the considerations. A lot of what we talked a little bit earlier about with Pamela. We've talked about the digital divide with our students and how that impacts care delivery, the ways that digital health can potentially increase access, but also worsen disparities as well, and what we can do about that. Talking about technology practically in our workflow in a pharmacy, talking about informatics, the development of clinical decision support tools, using simulated EHRs, doing telehealth-based counseling experiences. So we already counsel on medications and talk to patients about them, using that same experience, but in a telehealth or digital format. Talk about how digital therapeutic tools relate to different content areas when they are pertinent to do so, and having some experiential opportunities for students. That can be them coming on rotation with me at my family medicine clinic and learning about CGMs and communication, or it can be a really focused digital health experience for some of our students that want a more intensive experience on developing a tool or the actual application of it.
For the development of the School of Medicine, we anticipate teaching about many of the same topics that Becky went over, and trying to do so in an interprofessional format. We certainly are very focused on the social determinants of health, and the digital divide is a big part of that. We're also talking about incorporating digital experiences into the educational program, learning aspects of anatomy using virtual or augmented reality anatomy combined with diagnostic imaging and point of care ultrasound training, so that we can really train students to utilize technology in unique ways so that they're more comfortable when they go out into practice. We're using both VR and AR in advanced simulation, and I think that's going to be really helpful for students to not only learn, but to be comfortable in some of the advances in digital health that are forthcoming. We'll be, teaching them about informatics, clinical decision support, and EMR use, and telehealth, and have telehealth-based educational experiences so that the students are prepared to go out and serve as physicians in the digital world. So the plan for the Duquesne Digital Health Initiative is to platform off of that and include a foundational interprofessional seminar series that will, incorporate both student and faculty educational content on these important topics so that there's an increased level of comfort and knowledge in this area. And then we expect that by doing so, we're going to unlock a number of opportunities in the future. And so the initiative starts by developing this longitudinal seminar series for students and faculty, but then can expand right into other opportunities like growth into other courses, maybe a certificate program or some type of credentialing for this, for students who maybe want to, be future chief information officers or developers of digital tools for patients in the future. And so while this project is initially targeted at the School of Pharmacy and the College of Medicine, we also see it expanding to the other health professional programs here on campus and beyond, because we know that digital health impacts all corners of healthcare. And so these are just a few examples of ways that we see it expanding as we move forward. So how could you apply this type of education to your practice in educational settings? Well, remember that you can integrate education and tools into residency clinics, clinical cases, community medicine experiences, right? You can start very simple and do it as an extension of what you're already doing. If we have an intentional focus on bringing digital health and the digital divide into the classroom, just like we need to have an intentional focus on the other social determinants of health and bringing that into the classroom and into our clinical educational programs, we can, really help our students and our faculty to think in a new way about healthcare. We can integrate this into our clinical cases, into our morning report discussions, into experiential learning opportunities. You can start simple by having, scholarly projects. Who are your champions that are most interested in this? And these can be projects directed at developing and researching technologies. And they could also be projects addressing the gaps associated with the digital divide and looking for ways and opportunities to address those gaps in meaningful ways. We can increase education through faculty development programs. Many residency programs in medical schools have a faculty development series. Could this topic be incorporated into that? And also just remembering and reminding our residents and students that just because it is digital does not make it quality, accurate, or regulated. So, sometimes we get very excited about a new tool or, sort of a fancy app, but we need to make sure that everything that we're using to, from point of care, evidence-based resources to digital tools that we're sharing with our patients are appropriate and helpful.
Absolutely. So building these cases in, as Amber said, and bringing in that intentionality of the practical experiences that you have, that's one of the ways that we're thinking about things is as we're talking about these patient cases, what are the real aspects of patients using these tools? If you have a diabetes case, bringing in a discussion with a patient that has a CGM and the practical aspects of that. So it's really a lot of what you're already probably doing, but just bringing that intentional focus and expanding on a few areas as our practice and delivery of medicine continues to evolve in this way.
Well, and I think the sort of last point I want to make is doing that collaboratively. I think there's so much opportunity, and that's what we're seeing here, right? For physicians to partner with our, pharmacy colleagues, right? There's so much about digital health that involves that interprofessional collaboration with nurses, with the various members of the healthcare team or case managers, right, and social workers. I think that providing this type of education in an interprofessional way and also encouraging that conversation can be really valuable.
Absolutely.
Thank you.
Well, I'd like to say thank you to all of our speakers today. Such insightful and impactful information that you shared. We opened it up for people to put questions in the chat, and Scott will let us know when there's some, but I do have a couple of questions for each of you to just get us started off. So for Pamela, you talked a little bit about digital redlining and the historical aspects of redlining that have had current impacts on our communities now from just neighborhoods have really affected health in a major way. Have you and your organization thought about what that future impact of our communities on digital redlining, what we need to look for in a health perspective, and what can we do to advocate to, eliminate digital redlining?
Mm-hmm. So what you can do is to partner with those anchor institutions that I had listed earlier, those housing authorities, education institutions, those people who are really connected with the community, listen to the community and what they need. Because sometimes, if you ask internet service providers, hey, what's going on here? They're going to say that, oh, internet connection is there. But then you're listening to, the individuals at home, and they're saying something completely different. So I would recommend to reach out to those community organizations and partner with them in a way that you can, and do it in a way that you're going to their community, and instead of those individuals and those residents coming into, our institutions, because then they're going to have to worry about additional barriers like traveling, commute costs, especially right now with things having to be socially distant. So that would be my biggest advice. And we know that digital redlining and not having access to internet, it has a huge repercussion on people's health, as well as their income, and just, their ability to provide for themselves and their family, and it trickles down. So, and right now with all of this new funding that's out there, I really recommend to reach out and search if there's coalitions that you can join, because they also have a say in the state digital equity plans. And you want to make sure that, your institution has a voice in that. You're coming in with that perspective of what patients need. And sometimes people don't have that on in their coalition. So I would recommend to join and reach out to those coalitions if they exist.
Thank you so much for that. Scott, any questions yet?
No, we don't, but I actually had one myself. I'm hearing Amber speak about how the telehealth visits, even though I think the whole public has heard that telehealth expanded greatly during COVID-19, to hear you talk about the kind of practice sessions and getting patients ready for it, and then that it doesn't happen as well as it should in different times, seems kind of like a natural connection between a hospital or health system and the community advocates that are helping people gain technology skills. Like, is there a way we can work together so that when the doctor joins the visit, the patient's already gotten some kinds of supports, maybe at the public library or somewhere else?
Yeah, absolutely. I think that's ideal. I think, working through the various barriers that caused, right? I mean, during COVID, these patients who had lack of transportation were at a free clinic, right? Were unable to physically come into the office. Also weren't able to go to a library, right? And didn't have the resources to get some of that taken care of. And so it sort of fell on, the free clinic staff and, the work that the health system or the pharmacy or, whoever was doing, because that was the person at the point of care that recognized the need. And I think that's why this is so important and such an important conversation. We need to be able to point people in the right direction to the right resources, and at least get them plugged into to those resources when our troubleshooting and our attempts to help are unable to be effective. And so I think that's where the value is in this, and where we recognize, right, gosh, we're not prepared to deliver this to a patient who's at a free clinic, right, and has these kinds of challenges. And so I think as much as we can train future pharmacists, medical students, residents, right? And even current practicing physicians. I think that can be just such an important and valuable tool. And then also community health workers, you know, social workers, right? A lot of the folks I was working with at the free clinic, this was their business, right? They knew the ins and outs of how to help the patients in every other area, but digital health was an area that was lacking.
Thank you so much. Well, it is 6:30. I do want to respect everyone's time. Just a reminder for everyone who is participating today, we invite you to join us in September for our FMEC conference. It is September 16th to 18th, and that will be in Crystal City, Arlington, Virginia. We look forward to seeing you all there. Thank you all so much for participating.
Thank you, everyone.
Thanks, everyone.
Thanks for having us.